pelvic organ prolapse is when one or more of the organs in the pelvis slip down from their normal position and bulge into the vagina. We looked at the female pelvis in an earlier video, and if you want to go through this in more detail, flip back to the video on female pelvic organs and pelvic floor. So let's just recap the picture of the female pelvis. The bladder sits behind the pubic bone, then the vagina, and then the bowel. The pelvic floor attaches from the pubic bone at the front, like a hammock, to the coccyx at the back. This is a picture of a uterine or womb prolapse. On the left is a picture with no prolapse. The right-hand picture shows a uterine prolapse, whereby the uterus moves down inside the vagina. It doesn't always come as far as the vaginal opening, like in the picture. It might just be lower, but still within the vagina, or it might protrude past the vaginal opening. If you have had a hysterectomy, it is still possible to get a prolapse. The top of the vagina can fold in on itself, giving you what is called a vaginal vault prolapse. This picture is looking a little more at the vaginal anatomy. The front or anterior wall of the vagina supports the bladder and the urethra, which is the tube you wee through. The back or posterior wall supports the position of the rectum. An anterior wall prolapse, also called a cystocele, is where the anterior wall between the bladder and the vagina begins to move down inside the vagina, giving the bladder less support. A posterior wall prolapse, also called a rectocele, is where the posterior wall between the vagina and the bowel begins to move down inside the vagina. This can give the bowel and rectum less support. This can seem very scary when it happens, especially when you might have heard it being referred to as a bladder or a bowel prolapse. If you see or feel a lump inside your vagina, please remember that it's not your bladder or your bowel that you're seeing, it is the vaginal wall. Because the vaginal walls are not supporting these pelvic organs so well, you can get bladder or bowel symptoms that we'll talk about in a minute. But it is the vaginal walls that you see or feel, not the actual bladder or bowel. Symptoms you might experience with a prolapse are a feeling of heaviness around your lower tummy and genitals, a dragging discomfort around your vagina, feeling like there's something coming down inside your vagina, or seeing or feeling a bulge coming out of your vagina. Discomfort during sex, difficulties having a wee. You might find it difficult to start, or you don't empty your bladder fully. You might need to go to the toilet more often, or you might find you'll start to get urine incontinence problems. Similarly, you might find difficulties emptying your bowel fully. Some women have to support their perineum. This is the area between your vagina and your anus while they empty their bowels, or even to have to insert a finger into the vagina to support the vaginal wall to allow the bowel to empty. Or some find it easy to help empty the bowel by putting a finger inside the anus.